Hi there, my name is Nancy Oliverio, and I am the Engagement Specialist here at Kaiser Permanente. I'm excited to be sharing with you this year's Open Enrollment 2020 plans for Lewis and Clark College. Today we'll be going over the HMO plan as well as added choice high deductible that is also HSA qualified, the added choice point of service plan, as well as alternative care coverage, vision coverage, and other important Kaiser Permanente information. Let's begin by reviewing the traditional HMO plan. Now with this plan, you're going to be seeking your services at Kaiser Permanente. And because of our partnership with the Portland Clinic, you're also able to seek services there as well. With this plan, there is a $0 deductible. Your out-of-pocket maximum is $1,250 for an individual, $2,500 for family. With this plan, your services are subject to a flat dollar amount copay. The great thing about this is that it makes your healthcare costs predictable. For instance, when you go in for your office visits, they are subject to a $15 copay. Specialty visits are $15, urgent care visits are $35, lab tests and x-ray, $0, CT, MRI, PET scans, $0, emergency room visits, $75 copay. However, that is waived if you're admitted. Inpatient hospitalization is $250. Outpatient surgery is subject to a $15 copay. Now for your prescriptions, generic copay is $15, preferred brand is $30, and non-preferred brand is $50. And this is all for a 30-day supply. If your prescription is eligible for mail order, you can certainly take advantage of that. With a mail order pharmacy, you're able to order a 90-day supply for the cost of 2 copays instead of 3. We also have alternative care services with this plan. For alternative care, we partner with the CHP group for services. Now these services do not require a physician referral, so this is self-referred services. You have chiropractic, naturopathy, acupuncture, and massage therapy covered under alternative care. And they are subject to $15 for chiropractic, naturopathy, and acupuncture, $25 copay for massage, in which you are eligible for 12 visits a year. There is a combined annual benefit maximum of $1,500 for all of the services. All right, let's review the added choice plan. The added choice plan offers you 3 levels of coverage, also known as tiers. Let's begin with tier 1. So tier 1's level of coverage is really similar to the HMO plan that we just reviewed. Tier 1 allows you to access services within Kaiser Permanente and the Portland Clinic. This tier will also offer you the highest level of coverage for the lowest out-of-pocket cost. Tier 2 allows you to access services within our PPO network, also known as First Choice Health. And Tier 3 is for non-participating providers. So these providers are licensed. They are not part of the Tier 1 or Tier 2 networks. With Tier 3, you're going to have the lowest level of coverage and the highest out-of-pocket cost. Within added choice, think of it as one plan, because it is one plan, and you're able to move between the different tiers at any time. So your cost is determined based upon where you are seeking services at that point in time. To give you a little bit more clarity, let's go to the next slide. So this is the plan design for added choice, the high deductible plan that is eligible to be paired with an HSA. You'll see here that there are 3 tiers, and the costs vary amongst each tier because it's determined based upon where you're seeking services at that point in time. For instance, in Tier 1, you're seeking services within Kaiser Permanente and the Portland Clinic. With Tier 1, your annual deductible is $1,500 for yourself or $3,000 for your family. Your out-of-pocket maximum is $2,500 or $5,000 for your family. Routine preventative services across Tiers 1 and 2 are subject to a $0 copay. The deductible does not apply. Under Tier 1, most of your services are going to be subject to 10% of the cost after you've met your deductible. For your prescriptions, those are subject to a copay under Tier 1. So for generic medications, it's a $15 copay. Preferred brand is $30, non-preferred brand is $50. You can also take advantage of the mail order pharmacy. Tier 2, there is an annual deductible of $2,500 for an individual, $5,000 for your family. Your out-of-pocket maximum is $4,000 or $7,350 for family. I do want to point out, between tiers 1 and 2, your annual deductible and your out-of-pocket maximum will cross-accumulate. So what that means is, if you satisfied, say for example, $1,500 in your deductible for Tier 1, that is also applicable to Tier 2, and vice versa. Okay? For Tier 2, your cost share is as follows. It's 20% after you've met your deductible, and then your prescriptions are subject to a copay. Tier 3, again, is going to be the highest out-of-pocket costs for you. The deductible is $3,500, and then for your family, it's $7,000. Out-of-pocket maximum is $5,000, and then $10,000 for family. And then your services are going to be subject to 30% after your deductible is met. Bear in mind that this tier does not cross-accumulate with the other two tiers. Next, we have the added choice plan that is not HSA compatible. We're going to review the 3 tiers again. So Tier 1 is through the Kaiser Permanente network, as well as our partnership with the Portland Clinic. With Tier 1, your annual deductible is $750 for individual, $2,250 for family. Your out-of-pocket maximum is $2,250 for an individual, $4,500 for family. You'll see here that most of your services are subject to a copay. The great thing about this is that it makes your healthcare costs predictable. With the exception of inpatient hospitalization and outpatient surgery under Tier 1, those services require a 10% coinsurance after the deductible is met. As for pharmacy services, you would pick up your prescriptions through a Kaiser Permanente pharmacy, and your costs are as follows: $15 copay for generic medications, $30 copay for preferred brand, $50 copay for non-preferred brand. And again, bear in mind that you can take advantage of the mail order pharmacy if your prescription is eligible. Now, under Tier 2, with our PPO provider network through First Choice Health, your annual deductible is $1,000 for an individual, $3,000 for a family. Your out-of-pocket maximum is $3,000 for an individual, $9,000 for family. And again, bear in mind with Tier 1 and Tier 2, your annual deductible as well as your out-of-pocket maximum will cross-accumulate. So if you satisfied, say for example, $750 in your annual deductible in Tier 1, that also means that you satisfied $750 in Tier 2 and vice versa. And your services are subject to copays under Tier 2. Office visits are $25, specialty care $50, urgent care is $50. Lab tests and x-rays, CT, MRI, and PET scans are subject to 20% coinsurance. Inpatient hospitalization and outpatient surgery are subject to 20% coinsurance after the deductible is met. I do want to point out real quick, so across Tiers 1, 2, and 3, the emergency room copay is subject to a $250 copay, and that is waived if you're admitted. For pharmacy services under Tier 2, the cost of your prescriptions are subject to a copay, and you would access pharmacy services through our Med Impact Network. Now I'll go into a little bit more about the Med Impact Network in the coming slides. Then Tier 3, again, it's for non-participating providers, so providers who are not contracted under the networks of Kaiser Permanente or First Choice Health Network. Bear in mind that your cost, out-of-pocket cost, is going to be the highest, and this is going to offer the lowest benefit coverage. So your annual deductible under Tier 3 is $3,000 for an individual, $9,000 for a family. Your out-of-pocket max is $6,000 for an individual, $12,000 for a family. And then your services, all with the exception of the emergency room copay, are subject to 40% after the deductible is met. And then under Tier 3, you would utilize the Med Impact Pharmacy. You have alternative care services under this plan. Your services are subject to a flat dollar amount copay and a combined benefit maximum of $1,500 per year. Under Tier 1, you would seek services with providers under CHP group. Tier 2 is through First Choice Health Network, and Tier 3 are for non-participating providers. After $1,500 is met, your benefit maximum is met for the year, or if you've maxed out on your 12-visit massage therapy limitation, you're eligible for a 20% member discount for any additional services that are provided during the calendar year. This is specifically with providers in the CHP group network. To find a provider under CHP group, you go to chpgroup.com, and if you can see here on the slide, there's a green button on the upper right-hand corner, select Find a Provider, and then you'll have the next page pop up, and there's a drop-down for the plan. Please select Kaiser Permanente Self-Referred. From there, you would select the type of service that you're looking for, massage therapy, naturopathy, for example, and then enter in your zip code, and it'll populate the providers within your service area. If at any point in time you have any questions, you can certainly reach out to CHP Group. They're here locally in the Portland area. There's their phone number and your email address listed there that you can contact them through. This is a vision coverage for this plan. As you can see here, there are also 3 tiers of coverage, with Tier 1 being with Kaiser Permanente in the Portland Clinic, Tier 2 under First Choice Health Network, and Tier 3 for all other providers. For the adult eye exam under Tier 1, you can go to Kaiser Permanente or the Portland Clinic. That eye exam is subject to a $15 copay. Under Tier 2, it is a $25 copay. And then Tier 3, bear in mind that the deductible has to be met, and your cost share is 40% after the deductible. For vision hardware, you'll have an allowance of $250 for eyeglasses or contact lenses. And this resets on January 1st every year, regardless of the date of the last usage. So say, for example, you purchased eyeglasses back in August of 2019. Your benefit would then renew January of 2020. So here's a sample of what your medical ID card looks like depending upon which plan you select. On the left-hand side is the Kaiser Permanente traditional HMO plan, where your card is distinctly blue with the Kaiser Permanente logo on the front. It also has your name and your date of birth, as well as your medical record number. On the right-hand side is a card that you would receive if you have the added choice plan. What you'll notice here is a distinct color, as well as the First Choice Health Network, as well as Med Impact, which is your pharmacy network, embossed on the front of the card. The reason why Kaiser Permanente is not on the front of the card is because we want to eliminate any confusion that providers may have when you call to make appointments. So for instance, if you're selecting to seek a provider within First Choice Health, when you do call to make that appointment, you want to indicate that you have the First Choice Health plan. On the back side of the card, you'll see Kaiser Permanente is embossed on the back. You'll also find additional information such as pharmacy billing information, the phone number for prior authorizations, and where claims can be mailed to in any circumstances that you would need to do so. This information is more so for your provider, but it's there for you to access as well if needed. You'll see on this next slide what the PPO network coverage looks like. So you'll find that there are the green states that indicate First Choice Health Network, and the blue colored states is First Health Network. Really, this is just a naming convention. So depending upon where you are, let's just say you're visiting California, the network that you would access would be First Health Network. In the state of Oregon, it would be First Choice Health. And as you can see, it's a very vast network that allows you access to more than 88,000 providers within First Choice Health. In order to find providers, the PPO providers in any facilities, at the very bottom of the page, you'll find the specific website, kp.org/added-choice/Northwest. You can also call our concierge team at 503-813-1299 or email them if at any point you have any questions or concerns about provider access. This is what the website looks like to be able to find services under the First Choice Health network for the Added Choice plan. Definitely use this website, the kp.org/added-choice/Northwest, because this is specific to your plan. Once you get onto the page, you'll find, highlighted here in yellow, Tier 2, the PPO tier, and then depending upon what state you're in determines which network you would utilize. So for instance, if you're in the state of Oregon, you would go to First Choice Health Network as highlighted in the bottom of the page. If you're visiting any other states, you would go to the First Health Network link. So that way we ensure that your coverage is within the Tier 2 network. And again, at any point in time that you have any questions, please do not hesitate to call or email our concierge team. They are there to provide the support to help you with your transition of care or to help you identify any providers and services. You'll find here that there are an extensive list of First Choice Health affiliated hospitals in the state of Oregon, such as Legacy Hospitals, Samaritan Health Services, OHSU, Dornbeckers, just to name a few. The providers that are not part of the First Choice Health Network that is affiliated with the Kaiser Permanente plan would be Providence. So any Providence providers will be out of network and services will fall under Tier 3. For pharmacy coverage under the Added Choice High Deductible Health Plan that is HSA compatible, as well as the Added Choice plan that is not HSA compatible, you have a number of different ways in which you can have your prescriptions filled. Under Tier 1, which is the Kaiser Permanente network, as well as with the Portland Clinic, you can have your prescriptions filled in person at any Kaiser Permanente pharmacy. If your prescription is eligible for mail order pharmacy, and again, this is under Tier 1, you can certainly take advantage of the mail order pharmacy. There is a cost savings where you can order a 3-month supply for the cost of only 2 copays instead of 3. It is quick delivery because the mail order pharmacy is located near the Portland airport and shipping is free. For Tiers 2 and 3, we utilize what's called Med Impact, which is our pharmacy network that includes pharmacies such as Walgreens, Fred Meyer, Safeway, and Costco. Please bear in mind, so there's a little bit of a note down at the very bottom of this page here. If there is a generic equivalent that is available to you, and you or your provider decide to go with a brand name prescription, please bear in mind that you are responsible for paying the difference in cost between the brand name drug and the generic equivalent, in addition to the copay. For any questions that you may have about pharmacy services or costs, please do not hesitate to reach out to our Kaiser Permanente concierge team. They'll be able to help identify any questions or see if your prescriptions are on a formulary, etc. In the event of a major medical event, please bear in mind that some services do require pre-authorization at least 48 hours in advance. On the right-hand side here, you'll see a comprehensive list of what does require that pre-authorization. Services that do not require that pre-authorization are things such as emergency services, maternity care, routine office visits, durable medical equipment under the cost of $500, and outpatient labs and x-rays. Otherwise, you'll find the phone number here for prior authorizations. It's also listed on your Added Choice card. For those of you who may be brand new to Kaiser Permanente, please bear in mind that we have a team that is there to provide support to you. With our concierge team, they're available to provide support to you in ensuring that your current provider is within our network, to ensure that your prescriptions are within our formulary, and to address any upcoming medical events that you may have or procedures that you may be considering. We want to make sure that your transition over to Kaiser Permanente is as seamless as possible. So we have that team there in place to provide that help and support for you. So please don't hesitate to give them a call or email. This concludes our open enrollment presentation for the 2020 plan year. If you have any questions, please do not hesitate to reach out. We look forward to seeing you. Take care.